What makes E. coli so good at causing UTIs? Imagine bacteria that can switch from harmless residents in your gut to sneaky invaders in your urinary tract. That's exactly what Escherichia coli, especially the uropathogenic strain, can do. These bacteria are responsible for most urinary tract infections, making them a major health concern. So, what makes them so effective at causing these infections? First, these bacteria originate from the gut, where they live peacefully without causing harm. But they have a remarkable ability to adapt when they reach the urinary system. They can survive in urine, which is quite different from the intestinal environment. They do this by being metabolically flexible, meaning they can use different nutrients available in urine, bladder tissue, and even the kidneys. This adaptability helps them thrive in places where other bacteria might struggle. A key factor in their success is their ability to stick to the lining of the bladder. They have special surface structures called fimbriae or pili, with type 1 fimbriae and the FIMH adhesin being especially important. These structures act like tiny anchors, allowing the bacteria to cling tightly to bladder cells. This adhesion prevents them from being washed away when you urinate, giving them a foothold to multiply. Because they can also bind to mucus layers in the gut, they can maintain reservoirs in the intestines and seed the urinary tract repeatedly. Once attached, a peck can invade bladder cells and form tiny communities inside them called intracellular bacterial communities. Inside these cells, they are protected from the immune system and antibiotics. Some can even hide in deeper bladder cells as dormant reservoirs, known as quiescent intracellular reservoirs. These can stay hidden for months and cause recurrent infections when conditions are right. Uropathogenic E. coli also produce toxins that damage tissues and help them invade further. Hemolysin can cause cell damage and inflammation, which can lead to symptoms like pain, burning, and frequent urination. Cytotoxic necrotizing factor 1 manipulates host cell structures to help bacteria invade and persist. These toxins not only cause tissue damage but also help the bacteria ascend from the bladder to the kidneys, leading to more serious infections. Biofilm formation is another trick these bacteria use. Biofilms are protective layers that bacteria create on bladder surfaces or inside cells. These layers shield them from antibiotics and immune responses, making infections harder to clear and more likely to recur. A peck also has ways to evade the body's defenses. They can cause superficial bladder cells to shed, which might help them avoid immune detection temporarily. They can also adjust their metabolism and virulence factors to better survive in the urinary environment and under immune attack. All these factors combined make E. coli especially good at causing urinary tract infections. Their ability to stick, invade, hide inside cells, produce toxins, and form biofilms allows them to persist and cause recurrent issues. For anyone experiencing symptoms like burning, urgency, or cloudy urine, it's important to see a healthcare professional. Proper diagnosis and treatment are essential because these bacteria can be persistent and sometimes lead to more serious infections if left unchecked. Understanding how E. coli operates helps us develop better prevention and treatment strategies, especially for those with recurrent UTIs or bladder health concerns. Always remember, individual experiences vary, so personalized medical advice is key.